Well, health surveillance teams continue to keep a close watch on the islands of Bimini, Andros, Exuma, and Eleuthera that have seen increases in COVID-19 cases. Chief Medical Officer Dr. Pearl McMillan says COVID-19 has placed significant challenges on the healthcare system. Despite a decrease in admissions, however, she confirms that there are resources to cover the family islands.
Certainly, New Providence is our hub, and as it relates to persons who become infected with COVID-19, we have to monitor those persons for symptoms. That places stress or excess, I would say, duties and responsibilities on the healthcare teams on the ground. And as these persons deteriorate, we then need to ensure that they are managed until we are able to actually bring them out of the particular island, and of course that is at a cost. We have in place a system where we have air evacuation, but of course it is a requirement for that process that you stabilize the person, and you have to wait until you are able to bring that person out.
COVID Task Force member Dr. Julian Bartlett acknowledged the contributions of surveillance team members on islands that have seen an increase in cases.
Once we have identified a case, the case that is symptomatic is presented to the clinic, or if the case cannot even come to the clinic, we actually do home visits and we go out. The case is immediately swabbed, isolated, and contact tracing began. So that's how we are operating on the islands to mitigate the spread of COVID on the island. And that's why we try to keep ahead of it rather than running behind it, so that the healthcare team is not further stressed in an already stressed environment.